Hi, I'm attorney Ben Schwartz, and today I'm going to talk about retained surgical instrument cases. And specifically, I would like to just give you some thoughts on a question in my mind, which is why do we still have retained surgical instrument cases? A retained surgical instrument case is this. Someone goes in for surgery, and the physician is using, scalpels and sponges and all other types of surgical instruments. In some cases, the physician or the nurses or whoever is working in the patient's surgical site will leave the instrument or leave a sponge behind, and then the wound is closed, and this causes problems. Sometimes it can cause terrible infection, it can cause lots of pain in that local area, it can cause death, it can cause all kinds of problems. And we, from time to time, see retained surgical instrument cases in my practice. And so I'm wondering, why do we have these cases? The short answer is human error. Whenever you see one of these cases, there is some element of human error that caused it. The surgical team is supposed to be counting the implements, counting the instruments, and the number of items they start with is supposed to be the number of items that they end with. But even as simple as that sounds, human error does occur and things get left behind. And this happens across the United States thousands of times every year. But I want to ask the question, why do we have to rely on humans to count the in and count the out when it comes to surgical implements? There is technology today, it's called RFID, and essentially you can tag each one of the sponges, each one of the instruments with an RFID tag, and then use a scanner at the end of the surgery prior to closing the surgery site to make sure that nothing got left behind. And this is it's inexpensive technology. It's not anything that is really cost prohibitive when you consider the cost of when you consider the cost of the time that goes into doing the counts, when you consider the cost of the expense of going back in later and removing surgical implements or instruments, when you consider the cost of the legal claims that result from leaving things in surgical sites, when you consider all the costs, putting RFID tags on surgical implements is of minimal cost. If you want to check this out more, you can go online, Google a company called Xerify, Xerafy, and basically they manufacture autoclavable RFID tags. That means they manufacture tags that can be put on surgical implements that then can be, sanitized and the tags don't fall off. But I'm just interested to know, what do you think, if you're a physician watching this, or if you're an attorney watching this, or a patient who's had a surgical implement or instrument left in your surgical site. I'd be interested to know what you think. On a personal note, both I and my wife have had surgery and had things left behind. And so, I would appreciate it if you don't contact me and say, oh, this isn't a problem, because I know from personal experience this is a problem. This is a very major problem. But I'd be interested to know what you think. So shoot me an email, ben.schwartz@schwartzandschwartz.com, or you can go on our Facebook page, leave a comment there. We're at facebook.com/schwartzandschwartz.